very much, Susan. I will quickly move past the title. We started to have some of these conversations a little bit yesterday, and it was interesting. I went through, we do global social media monitoring around the world around all kinds of vaccines, and a special one of the specific ones we look at is HPV. And I was really struck when I looked through it in the last few days for this presentation that actually there was a lot of very HPV specific articles or posts or whatever that had nothing to do with COVID. I was quite pleased actually to see that. But I did find a number of issues relevant to COVID. And one was certainly responding to public questions about, well, what do I do about the HPV vaccine? And part of it was, as we see with vaccines more broadly, and other health interventions in the context of lockdown, in the context of the restrictions, in the context of health systems and health professionals very focused on COVID. That was a stress that everybody shared, including HPV vaccine programs. But there was also the issue of contagion and going to the clinic and whatever. But in general, there's more and more. I saw in a number of different references, clinics encouraging people to come for their vaccine, but making sure that they did it in a safe way. There were other issues, quite concerned about as we raised, I think yesterday, that can you give these shots at the same time? And back in December, in China, the National Health Commission was warning against taking experimental, as they called it, even though some of them were approved. But at that stage, I think that's probably a more honest way during a term. And so the decision there was to discourage and say that you should get it at a different time, which I'm not sure what the evidence base, but maybe it was more precautionary, because I understood from the discussion yesterday that there was a sense that that wouldn't be a problem. But I think at this point, if they were being precautionary. There were other articles and discussions that have looked at, well, not just with HPV vaccine, but with other vaccines, but particularly in Japan, where there have been issues with confidence and acceptance of the COVID vaccine. An interesting article on lessons learned from the anti-HPV vaccine lobby, as we're very familiar with. But their conclusion, and I think it's an important one, is the time is right, and this was written last June. The time is right to plan a media campaign containing uniform and consistent messages so that the benefits of the vaccine can be realized for COVID. So this wasn't about the HPV vaccine per se, but the lessons learned and what Japan has been through with the panics around the HPV vaccine. So their advice, it's a little late for this, I hope they've done it, but this is already nearly a year ago advice to get communication early. In the UK, the main issue has been, again, because of school disruptions. It's a very school-based program. It's one of the highest of acceptance rates of a number of countries, and it has a very successful, I would say, school-based program. But that's been disrupted because there's no school. It's just starting to come back. But the guidance now that, this was last July already, that to accelerate on getting any eligible children at least their first dose and maybe stagger the second dose. But there's a conscious effort and guidance on how can we catch up from lost time, as it were. There has been an impact on uptake of vaccination as well as cervical cancer screening. The NCD Alliance has some interesting data on their website on some of the impacts that they particularly refer to Tanzania, where only 20% of the HPV vaccination goals were met in the initial months of the pandemic. Which is interesting that it was in Tanzania, because that's a country that actually there was a lot of denial from the level of the president about the risks and the threat of the pandemic. So even in a country that was playing down the gravity of the pandemic, there was a significant drop in uptake of the vaccine. And the issue of cervical cancer screening, it talks about in Zambia, the cervical cancer prevention providers saw a 40% decrease in the number of women seeking services. So we've got a lot of catching up to do, and that's an opportunity. I think we've got catching up to do across a number of healthcare issues, but this is certainly one. WHO and UNICEF have had quite a few warnings and concerns out there about the significant impact on childhood vaccines, and that includes adolescent HPV vaccines. And they had already called out last July. The data already before the pandemic showed that improvements such as the expansion of HPV vaccine are in danger of lapsing. And so one of the points of their article there was that already we had some wobbling programs before the pandemic hit. This is another blow to progress, and we need to be thinking about how we can make a catch up without risking a lot of vaccine preventable diseases reemerging in the context of trying to get caught up. Now, there's only one last thing I'm going to mention here, and it's something that and maybe it's because I have been spending a lot of time on it on the HPV front with this issue of what some have called psychosomatic reactions, but this issues around HPV and girls reacting in school groups. In fact, one of the things I thought that, given the fact that we've seen a number of issues of girls in school fainting, nausea, other reactions after HPV vaccine, I thought, well, maybe if they're not in school, they won't have that group reaction. But as we know, we've had the Japan situation that went viral in Denmark, Ireland, Colombia, and with this kind of mimic behavior around the world for different reasons, because the drivers, the emotional, political, personal reasons for these reactions have been quite different. But the issue here, and this is having a knock-on effect, and we've seen this absolutely escalate in the context of COVID. Robert Bartholomew, who's one of the key researchers on the phenomenon of mass psychogenic illness, talks about the possibility that we may be witnessing a milestone where the primary agent of spread of the trigger for these reactions will be the internet and social media networks. In the context of COVID vaccine, particularly since it was, we're not in adolescent age yet, but it will be coming up. So I do think that we need to anticipate and think about this. There's a lot of psychological, psychosomatic, psychological, neurological. We see, I think I was reading in research recently, it was over 35% of people who have had COVID are more likely to have a range of psychological and neurological sequelae. And we have a broader population that's very fragile, very anxious. I think it's very different in different settings, but I have been wondering, will the COVID vaccine trigger any of these types of reactions? So far, it hasn't been an issue, but we are going to be getting into younger ages, and they are the most online. It's just something that I would say we should be paying attention to and anticipating. We have, I mean, WHO and GACS, the Global Advisory Committee on Vaccine Safety in 2019, has finally incorporated what I call vaccination reactions rather than just vaccine safety issues. And there's a lot of guidance in there. I have been actually encouraging some clinical colleagues to, I think it's actually an excellent guide. It talks about preparedness. It talks about when people do have reactions, how do you mitigate that? How do you make that vaccination experience more comfortable, more relaxing? And I think particularly as we're seeing more risks with COVID vaccine, that people might be more anxious. But I do think that this field and that, frankly, it's the HPV vaccine experiences that have brought this issue to the fore, even though it's not just an HPV vaccine specific experience. That's it. This is my book Stuck. Some of you know about it, but there is a whole section on this particular issue. Thanks so much.